Good morning. Woo. And welcome to the University of New England's 2024 White Coat Ceremony. I am Dr. Robin Risling DeYoung, the Program Director for the UNE PA program. The White Coat Ceremony is a time-honored tradition in PA schools. However, it had its start in medical school with Dr. Arnold P. Gold, who is credited with instituting the first symbolic white coat ceremony in 1993 at Columbia University. He believed that medical students should have guidelines regarding the expectations and responsibilities appropriate for the medical profession when embarking upon medical education and training. Many health professions have adopted this ceremony, including the physician assistant. Students, take note of the length of your white coat. It is a short white coat on purpose. The short white coat denotes your status as a student learner. Upon graduation and successful passing of the pants, you will change over to the full-length white coat and practice as a full member of the healthcare team. Today is a very important day for our PA students. Today's donning of the white coat marks the transition from didactic studies into the real world of patient-centered care. Accepting the white coat denotes your acceptance of the privilege, honor, and responsibility of caring for patients. It is important that you all take seriously the powerful message the white coat sends to the public. Your white coat symbolizes to your patients that you can be trusted, that you can be depended on, and that you have their best interests at heart. Your white coat gives patients a sense of hope, compassion, help, and understanding. Patients will entrust you with their lives and confide in you their utmost vulnerabilities. Students, while on your rotations, you may feel disconnected to your classroom professors and the UNE campus, which has been your home for the past year. So rest assured, you still have the dedicated support of your faculty, staff, and the UNE community at large. And on that note, I would like to introduce to the podium someone who has had your back all along and who we all have counted on in the PA program for care and support. She is our dean. Her commitment to students, faculty, and staff has been unwavering, and we all have a special place in our hearts for her. Please welcome Dean of the Westbrook College of Health Professions, Dr. Jen Morden.
Good morning. I'm just so enamored by the large crowd here in support of these wonderful students. It's very heartwarming to see the support here. Welcome to the Portland campus for Health Sciences and the Westbrook College of Health Professions. I want to first congratulate the students for the first year accomplishment. I know how difficult the first year is for all of you. I know that it's been a very, very rigorous curriculum and time for you, but you have made it through that first year. And this white coat ceremony symbolizes your next trajectory of going out and caring for the public. This time next year, you will pass the PANCE exam. More than likely, we have a very good record here at UNE with the PA program with pass rates. And if you don't the first time, you will the next time, but you will get there. And so next year, when that privilege of being able to go out and care for the public is upon you, you will soar. And I want to thank all of the parents, spouses, friends, loved ones in the audience for holding you up this year, because I imagine there were times when you really needed that. So thanks to loved ones in the audience. Congratulations to the students. And I would be remiss if I didn't mention something about this very talented group of people behind me and in the back row behind the students. Faculty and staff have turned themselves inside out, year in and year out, to provide exemplary education to these students. One more piece of advice, keep your coats white. Don't let them get dirty. And I am looking so much forward to the rest of the event today. I would like to welcome to the podium Steve Blessington, who will be the first faculty speaker. Thank you, Steve.
Good morning, class of 2025. First, I'd like to say thank you for the honor to be able to speak to you today. Before I share my thoughts, I'd also like to say happy pre-Mother's Day to any of the mothers in the class, the audience, and the faculty here. Most importantly, to all of you, congratulations. You have weathered an incredibly demanding first year and are about to embark upon your final phase of your formal PA training. I truly hope you all take some time to reflect on how huge an accomplishment you have achieved. The rigors and demands of the didactic year are enormous. Through your perseverance, commitment, dedication, and diligence, you made it. As for the next year, this is your time to solidify the training and education you've attained. I know for many, if not all, this can be a stressful and nerve-wracking endeavor. Unfamiliar hospitals, new providers and mentors, and real patients with real medical problems. You may ask yourselves, am I truly prepared for this? The answer, my friends, is mixed. In truth, even after 30 years of practice, I still ask myself that same question as I head into Maine Medical Center before every shift. And I think, quite frankly, that's a good thing. The field of medicine is an ever-changing environment in which providers like yourselves need to constantly learn and grow, adapt, and practice evidence-based medicine, all the while keeping the patients and their families' needs at the forefront of your mind. In short, I know you're prepared for this. I have worked side by side with the UNE second-year clinical students throughout my career and am consistently impressed with your training, professionalism, dedication, old man eyes here, and your bedside manner. UNE produces PAs that are second to none. I am honored to work alongside UNE PA graduates that were my students just years before, and now I learn from them. If I may offer a few words of advice. Enjoy the ride over the next year. This is your time to learn and further hone your skills while under the supervision and guidance of seasoned professionals. An important and unique feature of the PA model is it allows you an opportunity to practice in different fields of medicine over your career. Utilize this next 12 months to perhaps determine what field of medicine you want to practice within. You may have some preconceived ideas, but embrace each new rotation as an opportunity to learn new skills and challenges. Develop your bedside manner. Every clinician has their own style, methodology, and approach to interacting with patients and their families. You will develop your own style, and this next year is an opportunity to start that process. Remember this, you were accepted into this program because you had traits and qualities that the UNE program felt were admirable, exemplary, commendable, and principled. As you move through the next year and into your career as PAs, don't ever lose sight of who you are and those amazing qualities about you. Medicine is a tough field to work within. There are many demands that will be made of you throughout your career. The hours are long and the days can be tiresome. But if you remain true to who you are, why you chose this field, and always practice with the needs of your patients first, you will be rewarded with a career that is amazingly fulfilling and gratifying. Finally, hold your patients' hands. Talk with them. Get to know them when time allows. Healing takes place on many levels. Yes, you will need to examine, interpret tests and images, prescribe medications, write prescriptions, but not all healing is a result of those actions. Sometimes what the patient really needs is your time, your touch, your listening. Don't underestimate the power of those therapies. I'll end with a very brief story. When I was in my second year as a PA student, I was at the bedside of a patient. This was over 30 years ago, so many of the details I have forgotten. But I remember the patient asking what my role was within the healthcare team. I told him I was a second-year PA student and that I would be helping with his care. He said to me, "Steve, you have chosen a noble profession." At that time, I didn't think much about it, but his choice of words have echoed in my mind throughout my career. A noble profession. We all will spend thousands of hours at work throughout our lifetime. I think we all here today are blessed to have chosen a noble profession, the PA profession. Best of luck. Enjoy a bit of downtime. Thank you.
Hi, guys. Aren't you glad I don't have to rely on technology today? I don't have to have Evan or come up and plug in my computer. We don't have to turn on anything. No PowerPoints, no viruses. It's great, right? God, this will be the easiest talk I've ever given you guys. Wow, it's been a year since we first met. In some ways, it seems like I've known you much longer than that, and in some ways, it seems like just last week I was trying to learn your names. You arrived with enthusiasm, energy, curiosity, insatiable interests and ideals, and you've been able to sustain these characteristics throughout this past year, despite the challenges. You're ready to continue to work hard and begin the challenging, rewarding, and indeed exhilarating transformation from student to physician assistant. This past year, all of you have met academic and personal challenges. All of you have had successes and failures. All of you have sacrificed much and accomplished a great deal to reach this moment. As you move into the next phase of your journey, your entry into that sacred trust that is our profession, each of you will at some point struggle. Each of you will have doubts, and at some moment, each of you will sustain you in those difficult moments. You'll look in the mirror and may wonder, can I really do this? What will keep you going is your talents, your skills, the support of your classmates, the love of your family and friends, and the commitment of your teachers and your mentors. For us as a faculty, it'll be a privilege to walk a little further on this path with you. In a few moments, you will don your white coat for the first time. It is a simple act, but it represents one of the most important moments of your professional life. With this coat comes great responsibility and also great satisfaction. In your white coat, you will care for your patients and improve their quality of life, and you will even save lives. Today, your white coat is very light, but it has big pockets. And if you are like most PA students, those pockets will become filled with stuff very quickly. In your white coat, you will carry books, electronic tablets, and smartphones with apps and quick links to medical resources. In your white coat, your pockets will be filled with papers and more papers, to-do lists, patient labs, notes from patients' histories, and physical exams. In your white coat, you will carry pens and pen lights, reflex hammers, tuning forks, otoscopes, ophthalmoscopes, power bars, and candy bars. But always remember, there are two important things that go with your white coat. The first is you. You and your strengths and your vulnerabilities are what you bring to each encounter. And what you carry next to your white coat is your patience. Despite how incredibly amazing this faculty has been, the most transformative and lasting teachers, the most powerful and enduring marks on your life and your professional lives will be made by your patients. You will learn to partner with them in their care, and in the process of learning the art and science of medicine, your patients will share with you their most personal information. They will share this information so that you can help them, and they will trust you to help them. But in the process, they become vulnerable. Treat this information with respect. Maintain their privacy, and even when you don't agree with the choices that they make, care for them as you would your own family. You all know how strongly I believe that spirituality and medicine are interlaced, especially in terms of sacred spaces. In the Old Testament, there's a story of Moses tending his father-in-law's sheep, an ordinary day in an ordinary place, suddenly encountering his God, and the ground he stands on is now consecrated as holy ground. He's admonished to take off his sandals, for the place he is standing on is holy ground. Many of the world's religions have sacred grounds, whether it be that image of a burning bush, Mecca, a prayer rug, a transcendent experience at a stupa, a pilgrimage to a sacred land, or a wailing wall. But the concept of sacred ground also transcends religion, and in a secular sense, people commonly find themselves encountering a different spiritual plane in all kinds of places. The experience may sneak up on you, but it requires open eyes to be receptive to it. These spaces can be very ornate or very ordinary, ground that becomes extraordinary and carries with it a moment in which we seem to commune with something beyond ourselves. It could be a favorite place in nature, working in a food bank, quietly nursing a baby, removing a disfiguring lesion, delivering a baby, sharing the news that there is no cancer present, or holding a hand as the decision is made to enter hospice. As PAs, we originally sensed a calling to heal, a calling all of us answered and still follow. For all the things that get in the way of pursuing it well, we are still incredibly privileged to inhabit that sacred ground on which we meet our patients, people on a common journey with us, who literally and figuratively bear their bodies and souls before us with trust, with an assumption that we will come to them with humanity, compassion, and fidelity, to stand on this ground. And as we do so, we agree to leave behind the encumbrances and the baggage that we all carry. For the moment, we leave it all at the entrance to this sacred and mysterious place. So pause at the door, take a cleansing breath, enter the exam room, hospital room, ER cubicle, or operating room, and know you are standing on sacred ground. Congratulations, best of luck to all of you, and I am so excited to meet you next year on your new adventures.
Students, we will now prepare for the donning of the white coats.
I think Amy LaBelle is calling over the first group. I'd like to congratulate all of you, and I'm honored to call your names as we present your white coats. We'll start with the A's and go in alphabetical order. Jumana Alhanfi. Samuel Asamoah. Congratulations. Isabella Bonder. Victoria Bowler. Lydia Karen. Maddie Chase. Elizabeth DeLeon Cruz. Olivia Duncan. We'll find it. We'll find it. Julianne Duong. Mackenzie Dyer. Samuel Essig. David Gardner.
Hold on, I gotta fix it. We gotta fix it. Let's bring it in.
Shelby Guerrier. Isaac Getsky. Georgia Hansberry. Molly Hogan. Joshua Hughes. Kaylee Igo. Jillian Jarzabski. Leah Jennings. Tyler Kelly. Alexa Koenig. Beth Keenel. Courtney Lamphere. Ashley Levesque. Natalie Lux. Danielle McDonald. Brianna Matias. Olivia McPherson. Colin Morrow. Elias Pascarillo. Nicole Piet. Max Pistner. Coral, excuse me, Coral Robinson. JJ Sales. Abigail Sandstrom. Nicholas Silva. Evan Sisley.
Thank you.
Thank you. Samantha Smith. Sydney Sousa. You got it, girl. Lauren Spencer. Ross Stevenson. Jaylene Troutwin. Emily Waltz. Diana Whitman. And last but not least, Angelina Zacharias. Thank you all very much. Congratulations. Wear it well.
Look at you. That's a beautiful white coat. And hydrogen peroxide works wonders for stains. So keep it clean. Are you ready to recite the oath? Please stand and repeat after me. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence every time, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor. Congratulations, guys.
Next to the podium, I'd like to introduce Jaylene.
There are a lot of people here. This might be worse than an OSCE. I don't know. No, nothing is worse than an OSCE. Good morning. Thank you all for being here today. I know many of you have traveled really long distances and across multiple time zones to get here, so thanks. You all have probably also been subject to multiple stress-induced freakouts and breakdowns in the middle of conversations. This is unfortunately very normal as a PA student, but it's not how we will be forever. The support from all of you today is so appreciated, and the support throughout this entire year has been paramount to each of our successes in making it to this stage, so thank you all. I can't move forward with this speech or the ceremony before I acknowledge our core faculty, staff, adjunct professors, without whom we also would not have made it here. One of the things that sounds sometimes worse to me than being a PA student is being a professor for PA students. So the amount of material and at the speed you are forced to teach us is unbelievable. So thank you. And on top of that, managing the very different personalities of 46 PA students who are all frequently sleep deprived and acting quite delusional at times is a job in itself and probably should be done by a trained psychotherapist, so thank you. Thanks for talking us off all of the ledges and giving us the framework, knowledge, and skill to move forward and become clinicians. I'd also like to thank my classmates. I'd really like to thank you for enduring the numerous questions that I asked in class this year, and for some reason still nominating me to do this speech. I'm not sure what to make of it, but thank you. It's an honor to be up here and to be the one who tells the crowd how awesome you all are. This feels really surreal. When they tell you the days are long, but the weeks and months are short, they are not lying. This past year feels like it's been 5 seconds, but also an eternity. And in 1 year from now, we'll be graduating. It's unbelievable. A few weeks ago, maybe months now, I'm not sure, Professor Bates-Withers equated the didactic year of PA school to running a marathon. I guess I agree with CBW to a certain extent, because both of these things are extremely difficult, and it takes a devoted, hardworking, and emotionally questionable human being to complete them, which sounds like everyone here, but there are some differences. At marathons, there are thousands of people you don't know cheering for you, free snacks and electrolytes along the way, and you can set your own pace and take as many breaks as you want. I don't know about you guys, but I don't think this past year has felt like that at all. Many people also spend their lives completing dozens to hundreds of marathons. And again, I don't know about you, but I don't think any of us would necessarily want to redo this even once, so. But that's because getting through it one time is so challenging and exhausting and impressive that there's really no need to do it again. It would also be completely useless, but that's beside the point. Basically what I'm saying is I think PA school is way harder than running a marathon. And with this in mind, I hope you all can take a very deep breath and acknowledge the mountain you've climbed over this past year. I'm so incredibly proud of all of you, and you should be too. Over the past few weeks, I've heard multiple people mention how nervous they are to start clinical year. Some of the most popular phrases I've heard are, "I feel like I know absolutely nothing," or "I'm so scared to take care of human beings, what if I hurt them?" or "the imposter syndrome is so real." Just to be clear, I feel the same way. It's possible these actually are all my own quotes, and I'm just putting words into your mouth, I'm not sure. But anyway, I would just like to take a few minutes to remind you all of all the things you do know, and that you are capable, competent, and deserve to be here. Let's think back to anatomy. Yikes. We walk into the room, just over there, and this woman, who we've never met, is blasting Kelly Clarkson and drawing bizarre pictures of what we later learned to be muscles and nerves all over the walls. And then we are told we're responsible for learning the anatomy of the entire upper extremity and brachial plexus in 6 days. I remember getting back to my car and actually just bawling. And I have photo evidence of it, which is actually pretty funny to look back at and laugh at now. So it seemed like an absolutely impossible feat and felt like the upcoming week was going to be my last one in PA school. But it wasn't. We're here. We live to tell the tale. I don't know that I could recall all the nerves of the brachial plexus. I'm sorry, Shireen, but I can stand here and say that we got through it and we moved on and we did a lot of really hard things after that, and that feels really freaking good. Another one, how about our first graded clinical encounter in CliniSS at the end of the semester when we had to memorize 70-ish ROS terms. Remember how insane and impossible that seemed? And we all thought Professor Towns was out of her mind. But we did it. And then think about all of the cases in IS over the past few months and how many ROS questions you came up with without even thinking twice. That checkoff seems like nothing now. And I can confirm that no one thinks you're out of your mind, Professor Towns. There were several other wild assignments and expectations that we thought were absolutely impossible what we got through. But something I think really worth commenting on is the fact that the world outside of PA school does not stop. I know several people in this class have endured extreme hardship due to family, friend, relationship, financial, emotional, or medical issues. The ability to manage all of that on top of PA school and to not give up is a testament to the strength of each and every one of you, and I personally believe you're all unstoppable. One of the biggest concerns I've heard from everyone regarding clinical year is the fear of being apart. I personally think this will be the most difficult. The 46 of us have been pretty much inseparable for the last 360 days, figuring out how to cram information into our brains for exams in an absurdly small amount of time. Yes, Dr. Vilmore, I must confess, we all crammed all the time. I'm so sorry, but it worked out. We also, performed some weird physical exams on each other and really rotated picking each other up from rock bottom. We have relied on each other so heavily over the past year, and I know I could not have made it without all of you by my side. So this year will certainly be an adjustment. While this year has been heinous at times, it has also been incredible to build a strong bond with all of you. No matter where the world takes us in the next few years, we can always come back to this shared experience of PA school that no one else in the entire world will ever understand. Additionally, I know that many of us have different views on the world in terms of ethics, politics, religion, etc. But thanks to PA school, we all share something in common, and I think that's incredibly special and something worth recognizing. There's a Buddhist concept called Shoshin, also known as the beginner's mind. It's the practice of approaching life with curiosity, openness, and leaving your preconceived notions and expectations at the door. You might be wondering why I'm discussing Zen Buddhism in front of a class of 46 type A individuals and 500 other people, but I think this is extremely relevant to the field of medicine. We've learned time and time again that to create a differential diagnosis, you must be open-minded and consider all of the possibilities in order to not pigeonhole yourself and to find the best treatment for your patient. I promise I'm not trying to convince you to become Zen masters, but I'm trying to tell you tell you all to embrace being a beginner, to keep an open mind, and to remember that no matter how embarrassing it is, being able to say the words, "I don't know," is actually a strength. It shows that you aren't afraid to acknowledge where you are, and you recognize that you still have work to do, knowledge to learn, and skills to improve on. I think this will be incredibly important to develop relationships with preceptors, establish rapport with patients, and soak up all of the information and opportunities that clinical year has to offer. Medicine continues to change every single day, so we are never going to know the answer to every single question. In reality, no one will ever be an expert, so there's no point in trying to pretend you are one, especially as a second-year PA student. I hope you can take this concept of the beginner's mind with you this year when you're being extremely hard on yourself, and remember that your current blank slate will allow you to mold yourself into exactly the person and provider that you want to be. What an incredible opportunity.
Attention, please. There are 2 minutes remaining in your clinical encounter.
Thank God we do not have to hear that for a while. Oh my God. Yeah. Sorry, trigger warning. Anyway, I would just like to acknowledge one more time how proud I am of you all. Thanks for selecting me to speak today. I'm so grateful to stand up here beside you on this wild ride of PA school, and even more grateful to have our first year behind us. Thank you again to family, friends, professors, dogs, cats, Taylor Swift, Beyonce, and anyone else who has been part of this journey. We couldn't do it without you. Congrats, everybody, we did it!
Students, I want to congratulate each of you on arriving at this milestone. You have worked hard on this path to becoming a PA. The last leg of your journey has finally arrived with a profound symbolism and responsibility of what it means to wear the white coat. As you embark on your clinical rotations, be guided by the reason you chose this journey, to learn and evolve. This concludes the ceremony. Thank you all for your attendance. So the students will take their photos now.